love to introduce Christine Blanch, our good friend and co-worker.
Thank you guys for coming. I wanted to take a minute to thank the Breast Cancer Coalition for this opportunity. I've known Dorothy a very long time, and we've done a lot of events together. And we have very synergistic beliefs in helping people and education of the community. And as a Manhasset resident, I feel very blessed to have an organization like this amongst us doing all this wonderful work in our community, and also with the outreach participants. I've seen them bring relief and joy to so many women that are having to traverse this journey with cancer, and I just want to give them a round of applause. So my name is Christine Blanch. I'm a physician assistant, and I'm the owner of Integrative Healing Center, which is right in Port Washington. And we're here tonight because our goal is empowering people with knowledge in their health. People have heard the terms holistic, functional, complementary, and really, I really think that integrative medicine is the combination of the two worlds, my two worlds of medicine, which is conventional medicine and holistic medicine. And when I say holistic, I really mean looking at the whole person as a unit, instead of just looking at cardiac and just looking at neurology and just looking at the different parts of our body, but really listening to a patient's story is probably one of the most powerful parts for the practitioner as well as the patient in an integrative medicine experience. And patients will come, and we spend an hour and a half on the first new visit. And it's really just an hour listening to their story. And it's so much more than just allergies and medicines and medical history. It's what's happening in their life, what's happening with the stress in their life, what's happening with their nutrition, what's happened way before we get to see them sitting on the couch. Listening to their story and really listening to, like a detective, for the patterns and the red flags and the things that might suggest where a body went out of balance. Because that's really, I think, where all disease starts, is out of balance. And I think of myself sort of like a prevention partner. For people, you know, a lot of people are used to going to the doctor when they're sick. And we really try to get them to come before they're even sick, thinking more about how to be more vital. You know, if you're tired, if you're achy, if you're moody, if you're anxious, if you're sad, if you feel less vital than you did a year ago. Anybody can relate to any of those? There isn't anybody in this room, if we're being honest, that can't. And when you ask patients, you know, what is health? And, you know, if you really think about what does that mean to you, what does health mean to you, you're going to hear very different opinions from everybody that you talk to. You know, is health really just the absence of disease? For most people, I don't think that they think that. They think that they want to feel strong, they want to feel energized, they want to feel vital, they want to feel young. And that's really health. And I think health doesn't just happen. We have to actually load our toolbox to be able to stay healthy in the crazy world that we live in. The different elements that I think are very important to not only get someone healthy if they are ill, but keep them that way. So detoxification is something that is sort of near and dear to my heart. It's something I feel very passionate about. I do believe that the toxins in our environment are taking wear and tear in our bodies. The studies are out there, more and more information every day. Sometimes it can become a little overwhelming, you know, GMOs and pesticides and petroleum and BPA, and where do you start? And I always say to people, you have to just start with your first step. You know, the more you learn, the more you make better choices. And I think that's probably, you know, one of the major reasons we're here tonight, is that I really feel knowledge is power. And the more that you learn, the more that you can really take responsibility in your own health and protect not only yourself, but your family. So detoxification is something that we talk a lot about at the center, and we're going to actually touch on pretty much in all the stations tonight. So we're going to come back to that. Movement, right? So who doesn't know that exercise isn't good for us? But who actually makes time for it every single day? You know, movement is walking, is yoga, is you know, getting out there and getting the body moving. And we know that getting the cardiac up, you know, getting the cardiac status up is good for our hearts, right? We know that walking even 4 times a week for 20 minutes reduces the risk of recurrence of colon cancer. Now that's pretty incredible. These studies on exercise are not as many, but they're there, and they keep coming out saying, hey, we got to get moving to keep our body healthy and to oxygenate. We have connection. So I think connection is something that you don't talk about it a lot in your doctor's office per se. You know, it's not something that comes up in the 8 or 10 minute time that you have with them. But connection, I know that we all know is important. You know, we feel it. We need connection with our children. You know, someone gives you a hug, how powerful that can be, how healing that can be. Connection with our spouses, with our family, and even sometimes outside of the family. You know, finding your chosen family, if you will. You know, the people, your friends, the organizations like this that are near and dear to your heart that really feed you, I think is extremely important in health. Happiness. So I think health and happiness really have to go together, because I don't think anybody really feels healthy unless they are feeling some joy. And I usually ask my patients, you know, what brings you joy? So you have to actually really think about it for a minute. You know, is it the beach? Is it music? Is it dancing? Is it the ballet? And do we make a time for a little bit of that joy every day? Most people would say no, if they're being honest. You know, there's so much going on in the day that do we make time for those little bits of joy? Simple things like a gratitude journal, you know, keeping track of what makes us grateful and really tuning into that. There's studies showing that when you think about, like, I know for some people it's like the birth of their child or the day they got married, they experienced incredible joy. And if you close your eyes and you think about that moment, you can go back to that space. And they've actually shown that that's one of the most healing emotions that we have in our body is the state of gratitude. And then we get the biggie, stress relief. So everybody knows we live in probably one of the most stressful places in the world, right? Born and bred New Yorker, it's all around us, okay? And stress relief is really loading your toolbox with tools that will help you keep the stress from making you sick. So I do believe that stress is involved in every illness that exists, and some a lot more than others. And there's tons of studies to show us that this is true. But the stress is not actually what makes us sick. It's our ability to not be able to handle that stress. And one of the things that we're going to do tonight is try to fill your toolbox with new tools that you might not have come across that are very user-friendly, that when you walk out of here tonight, you will actually have tangible things that you can bring home and start doing right away that will help you heal and stay well and insulate yourself from the stress. And then there's nourishment. And I choose nourishment as opposed to nutrition because I think nourishment is very different than feeding ourselves. So we all know we need to feed ourselves. We need to have those meals throughout the day, or our blood sugar gets low, or we feel tired. But are we really thinking about the foods that we're taking in, and are they nourishing us? And it's something that you start to be more aware of. And one of the booths that we have tonight is our green smoothies, where you're going to actually taste one of the best things I think is nourishing. It's super friendly that everybody can do at home. But we're going to talk a lot about nutrition and the things that you can incorporate to really nourish yourself. So those are the components of sort of our care plan and our treatment approach to all of the patients that come to us. And the way that we set up this evening is I'm a very visual, hands-on learner, so I always feel like you really incorporate the stuff if you get out there and you play with it. So that's usually how we set up our events, because I think it's much more fun that way. Our first table here is our water table, and we have Pure 2O, and Antonio, Mazur, Anthony, who I met tonight. And they're here. They're going to talk about water. I talk about water all the time. The girls are probably really tired of me talking about water. But water is essential. It makes up such a huge portion of what we're made of, and we need it for so many vital functions in our body. But what kind of water are we drinking, and what do we have to be aware of? And those are all the things. These guys are the experts. And then we have Stacy Avadine over here, and Stacy is a yoga instructor, a meditation coach, prana healer, you name it. She's got lots of tools in her tool bag. And Stacy was actually my very first yoga instructor. She changed my life unbeknownst to her. And yoga is my bliss. It's what I love, and it brings me joy. And I think everybody should try it. I'm going to have her talk about several things that are related to stress relief, tools that we use at the center. But I think that's probably one of the most important things that we do for our patients, is really help them deal with the stress, to find those outlets to help their body heal. And then over here we have Cassandra and Sydney, and they are doing the Green Smoothie Station. Cassandra is a physician assistant like myself who happens to be incredibly passionate about nourishing your body. She could probably talk to you for 6 hours, which is why we brought the gong, because when the station is time to go, I'm going to bang the gong and she's going to have to stop talking. But we will be available afterwards to answer any questions that you have if you don't get them in while you're in the different stations. And then this is going to be my station here, and I'm going to be talking about my favorite tool, which is my thermography camera. And thermography is something that is part of our diagnostic process. It's a non-invasive camera that helps us pick up inflammation in the body. And it's been very powerful for me, for women with breast cancer, as well as breast cancer prevention, to use that to help them stay well, and also to put protocols in place to help prevent breast cancer, which is very synergistic with what we're doing here tonight. So I'm going to tell you all about that when you come to my station. And then over here we have Joanna, who's a physician assistant like myself, and Betsy, who's my right hand in the office. If anybody's ever been there, you know I can't function without her. She is amazing. And they're going to be talking about the essential oils, which is basically my medicine chest. And it's the medicine chest that I start to get patients aware of utilizing in their homes. Natural, very, very powerful essential oils that you can use for everything. I mean, I used to, when my kids were little, I was a Motrin mom. You know, I didn't know any better. I was a conventional medical person. You had a headache, you took Motrin. And now we go for the oils, because it's just a more natural and more effective way to treat different things like pain, and they'll tell you all about it.